Hey Rad friends, I have a question from Rana2395. Thank you for your question. So the question is for the humerus, the position where you don't level it over the head. So this is the question right here. So sometimes you can, so there's less mass that's going through the chest. If the patient's shoulder isn't hurting, it's recommended to bring the arm above the head like this or like this. But let's say they cannot. The shoulder's broken or they're having really bad pain and they can't lift it up, then it's fine to leave it down. If you're gonna leave it down, your technique's gonna go a little higher, right? But sometimes the machine will have the algorithm ready. Just make sure if the injured side is this side, the right side, then make sure that the left side goes up. So it's less mass cutting through and it's just from here to here and you don't have extra arm to cut through, right? So non-injured arm up, injured arm down. They can have it down by their side like this or right across, and if they can't bring the other arm up and they're having a hard time, they can hold this arm here, or you could just put a towel or some cushion to help them right under the arm, and they can hold it there. Or you can put a strap over and they can hold it and this arm goes up, or you can tape it. Use whatever you can to help you get the position and make the patient comfortable. You want the patient to be comfortable because you don't want motion and you want good pictures for the patient and for the radiologist. So the question is for the humerus, the position where you don't level over the head, what do you do with the superimposition of the chest laterally, and how do you collimate if you don't want to take the exposure of the chest, expose the chest from the start? Yeah, so the chest is going to be exposed. You have to. How do you collimate? So this is the tricky part. Some machines, you're going to collimate just to the humerus itself, so it's going to be this area, and then when you do the lateral position, you want both positions, the AP and the lateral scout. You want two photos of the scout so that you can measure the lateral side and have the line right mid coronal line there. And a way to position your patient, so if the patient's like this, and let's say they're on the table this way, you want to move the patient to the non-effective side so that this is like, let's say this is a table, right? So normally they would lay like this, but have them scoot over to the non-effective side so that the humerus lays towards the middle, the Z-axis of the machine. So then you're gonna want to collimate here, and then look at your lateral collimate up here. And when your picture comes out, it's gonna come out in a circle. So as long as you collimate, it should get that portion, and it will get some of the chest and all that stuff. Sometimes you can't avoid that. But I know when I was working on the Toshiba machine, you can go into your raw data and cone in and literally just make sure that you get like the view of where the humerus is all the way. I hope that makes sense. It's so hard to explain something and you don't have the thing right in front of you, but yeah, you can, if your machine allows you to reconstruct, go in and then just collimate, make your cone, not your ROI, but your display field of view smaller, because your scan field of view, it might be big because you're scanning through all of this, but as much as you can collimate, this side obviously is going to be long, and then this side you want it to go close. So that's what you're just going to have to do. It scans through the chest, bring your other arm up and collimate if you can. Use your raw data if you can, and then all the older machines you cannot. So yeah, hope that helps. All right, cheers, bye. Thanks for the question again.